I don't, Tony was gonna go home, but I don't know if she went home. Cause I don't know if Judish ended or did. Good afternoon, everybody. All take your seats. Thank you. Rebecca, are you all set? I know. Okay, Mr. Perlow. We're going to call the meeting to order for the Appropriations Regulation Protection and GGA public hearing for February 14th. I've been told it's a holiday. I'm not certain, but we're going to start off with Jonathan Perlow as our number one speaker. Sir, you have 3 minutes.
Thank you. Thank you, Senator Austin, Representative Nolan, and distinguished members of the Appropriations Committee. First, happy Valentine's Day to you, and thank you for being here late in the afternoon. My name is Jonathan Perlow. I'm a resident of Cos Cob who has been actively involved in working to strengthen our democracy in Connecticut for the past 8 years. I'm testifying to ask that your committee fully fund election implementation and administration and the protection of voting rights. To do so requires fully funding the Connecticut Voting Rights Act, state and local administration of early voting, the implementation and administration of no excuse absentee voting, and the implementation of other election reforms that may come before you, including ranked choice voting, which hopefully will pass the legislature this year. In 1787, at the Constitutional Convention in Philadelphia, a woman asked Ben Franklin, "What have we got, a republic or a monarchy?" To which Franklin, as everybody knows, replied, "A republic, if you can keep it." If there was ever a time that our democratic constitutional form of governance was threatened by authoritarian rule, it is now. An essential strategy to protect our democracy is to ensure that we have free and fair elections and that every voting age citizen has equal access to the ballot box. Connecticut voters have sent clear messages to you that making voting more accessible is a priority. Majorities of the electorate approved the early voting and no excuse absentee voting constitutional amendments. More than 850,000 voters took advantage of early voting last year. But making voting easy and accessible to everyone takes resources. Unfortunately, the governor's budget falls short of what's needed. Funding election administration, election worker training, and the Secretary of State's office is crucial to ensuring the health of our democratic system in Connecticut. In 2020, the Center for Public Integrity observed that outside of the South, deeply segregated Connecticut has some of the most restrictive voting laws in the country. Long lines on election day disproportionately affect Black and Latino voters. Over the past few years, voters and the legislature have made significant strides in addressing our restrictive voting laws. But our expanded freedom to vote can't be realized by all voters unless adequate funds are appropriated to ensure equitable, accessible, and inclusive voting, whether in person, early, or absentee. The NAACP calls the Connecticut Voting Rights Act the nation's most comprehensive state-level voting rights act. That's something we can all be proud of at this moment in history when the freedom to vote is under assault. But the protections afforded by the act mean nothing if the budget doesn't adequately fund the work needed to make the statutory protections a reality. So I'll close by asking you to please work with the governor to fully fund elections and protecting our freedom to vote. Thank you so much for your time.
Thank you. Have a nice night.
Thank you.
Up next is Patricia Rossi. Patricia, floor is yours. 3 minutes. It's not on yet. You got to push that button. Yep, there you go.
Great.
You're all set.
Thank you. Thank you. Senator Austin, Senator Anwar, Representative Ryan, Ranking Members Summers and Ackert, and members of the General Government A Subcommittee of the Appropriations Committee. My name is Patricia Rossi. I'm a co-president of the League of Women Voters of Connecticut, and I live in New Haven. I'm here to testify that we must increase, not decrease, funding for election administration and voter education in Connecticut. The governor has started the budgeting process by proposing a decrease when we've seen in the past year the great need is for an increase. At a time when voter participation rates are falling and we've changed for the better the way we can vote in Connecticut, we need to make sure we build confidence in our systems and voters know where, when, how, and why to vote. Without voter education, the reforms the legislature has put in place can't reach the voters who need them. It is the state's responsibility to run elections. Yet the state heavily depends on political parties and volunteer organizations like the League to educate voters on how, when, where, and why to vote. This is an abdication of responsibility and conveys a disinterest in whether Connecticut citizens vote. Fair elections don't happen without commitment and investment. Connecticut must step up to ensure that every voter, regardless of zip code or circumstance, has the opportunity to make their voice heard. I just want to say, I agreed with everything Jonathan Perlow said. I let him say a lot of it. But I think my value is because the League of Women Voters is on the ground during elections. We saw that there was a lack of information. There was a lack of knowledge of how to vote, where to vote. And I don't see how that's going to get fixed unless the Secretary of State has money for voter education. So thank you. And if you have any questions, I'm happy to answer them.
Thank you. We're all set.
Okay,
Have a nice night.
thanks.
Up next is Barbara Crouch. Barbara, the floor is yours.
Thank you so much. I am Barbara Richardson Crouch. I'm here on behalf of ROVAC, and I'm the Register of Voters in Sprague, Connecticut. Thank you tonight for having this hearing. The funding we received from the state for early voting was a major factor in the success and in alleviating many stressors that accompany the rollout of early voting. We were short on resources, trained poll workers, office supplies, infrastructure, and funding. We strove to ensure that EV ran smoothly from the perspective of the voter. We want voters to continue to utilize this option and not disenfranchise them to the voting process, especially for this new process. We were successful in part due to state funding, and we're grateful for last year's support. Equally, a party to our success was the support, knowledge, and training we received from the Secretary of State's office. Without this support, we cannot be successful and allow every voter to vote as they see fit. And an aside from the town of Sprague, we had an elderly voter who prefers to vote in person. She has her good days and her bad days with her health. I was very happy that on her bad days was not a day that she had to vote because she was able to take advantage of early voting and one of those days. I realize that the budget may be tight. We are experiencing more changes in the voting process in the last 5 years than we have in the last 15 years. With a cut in funding, I do not think early voting and other initiatives will run as smooth for the voters. So once again, thank you. And all of us are grateful for last year's support. And we advocate for continued support for municipalities and for the Secretary of State's office. Thank you.
Thank you. Up next is Thomas Burr. Mr. Burr.
Yes, good afternoon, Senator Austin and members of the Appropriations Committee. My name is Thomas Burr. I'm the Public Policy Manager of the Connecticut chapter of the National Alliance on Mental Illness, and I am testifying today in regards to HB 6864, the governor's proposed budget. For the record, NAMI is the nation's largest grassroots mental health organization dedicated to building better lives for the millions of Americans affected by mental illness. For anyone not familiar with NAMI and what we do, I have included more information in my written testimony. And regarding House Bill 6864 on page 120 under the heading Reallocations FY 2026, FY 2027, it lists the following. Consolidate funding for the Behavioral Health Advocate into the Office of the Healthcare Advocate. Quote, under this proposal, funding and staffing for the Behavioral Health Advocate would be consolidated into the Office of the Healthcare Advocate, unquote. As an organization, NAMI Connecticut and its members were very excited when the Office of the Behavioral Health Advocate was created during the 2023 session, but then again, dismayed when it seemed that the governor was in no particular rush to fill that position. And now we discover that this office is to be combined into the overall Office of the Healthcare Advocate. And please, I mean no offense intended at all to the good folks at OHCA, as they have been the only game in town for a long time and are very much a great help to our members and the public at large. but due to the unique nature of mental health conditions and the lingering stigma associated with them, this is a bit of a slap into the face of the mental health community, especially the cut in funding from $876,000 to $258,000. Issues with adhering to the parity laws in regards to health insurance coverage of mental health conditions is still a huge problem and a fight that shows no signs of ending anytime soon, as anyone who witnessed the complete meltdown of the Insurance and Real Estate Committee last session can attest. We decry the delays in the creation of this position and request that this position be filled as written in Public Act 23-101 as passed in 2023 and fully funded. Anything less than that, again, is an affront to the 20% of Connecticut citizenry who wrestle with a mental health condition in any given year. It should also be noted that we are aware of mental health service providers being cash only because of the low rates paid by private insurance and thereby forcing members of the public to pay out of pocket while paying the high costs of private insurance as well. We need more tools in the toolbox to be sure that private health insurance is doing their part for their customers and clients. When the private healthcare insurance industry is not doing its part, preventative care and effective early interventions happen less frequently, patients suffer, and the state often ends up picking up a more expensive tab. This cost shift is unfair to both the patients as well as the taxpayers of Connecticut. Therefore, we object to this consolidation and request that the change not be included in the legislature's final budget. Thank you for your time and attention.
Thank you, Mr. Burr. Have a nice weekend. Up next is Travis Woodward. Travis, the floor is yours.
Good afternoon, Senator Austin, Representative Walker, Senator Summers, Representative Nucio, and members of the Appropriation Committee. I see you, Representative Nolan. My name is Travis Woodward. I'm a resident of Hamden and an engineer for the Connecticut Department of Transportation. I'm also the president of CSEA SEIU Local 2001, a labor union representing 25,000 state, municipal, Board of Ed, active and retired public and private sector workers. I offer the following testimony on the budget for the State Contracting Standards Board. For many years, I've come before this committee to ask that the work of the State Contracting Standards Board be properly funded. And although it took longer than I would have liked, over the past couple of sessions, the State Contracting Standards Board began to receive the funding it needs to properly do its work. This funding has allowed the board to hire needed staff. With an executive director, chief procurement officer, staff attorney, accounts examiner, research analyst, and trainer, the board is able to live up to its mission to require that state contracting and procurement requirements are understood and carried out in a manner that is open, cost-effective, efficient, and consistent with the state and federal statutes, rules, and regulations. State Contracting Standards Board was established in 2007 after 15 years of advocacy to bring real oversight and transparency to state contracting. The board's formation came on the heels of the I-84 storm drain fiasco. Private consulting inspection forces failed to notice that the construction company did not complete drainage runs during the construction of I-84 heading west into Waterbury. A DOT engineer from CSEA SEIU Local 2001 discovered this $24 million error that could have eventually led to the highway washing out, causing catastrophic damage and possibly loss of life. State Contracting Standards Board has done and continues to do critical work on behalf of Connecticut taxpayers. In 2018, the board issued recommendations showing the potential for annual savings of up to $264 million if the state engaged in competitive bidding for POS, PSA, and procurement contracts. After the board's approval of the Department of Transportation plan to return the work of bridge inspectors to state employees to save over $2 million in fiscal year 2019, the board's privatization contract committee created the necessary process for reviewing privatization efforts by agencies. And more recently, we have seen the oversight of the board has directed the Connecticut Port Authority. I encourage you to continue to fund the State Contracting Standards Board and to block any efforts to weaken or diminish its ability to deliver accountability and transparency for Connecticut taxpayers. I'd like to thank you for hearing my testimony. Happy Valentine's Day.
Same to you, Travis. Up next is Christian Damiano. I'm sorry.
Good evening, Senator Austin, members of the committee. My name is Christian Damiana, and I'm the Public Policy Manager at Mental Health Connecticut. In this role, I coordinate the Connecticut Parity Coalition, which is a group of more than 25 member organizations working to elevate behavioral health equity across our state. We're grateful that the General Assembly took an important step in 2023 to protect patient access to behavioral health care by creating the Office of the Behavioral Health Advocate. The office would be essential in monitoring compliance with parity laws, receiving provider complaints, and holding insurance companies accountable. Most importantly, the behavioral health advocate would have the authority to pursue administrative remedies and refer suspected parity violations to the insurance commissioner, strengthening accountability within the insurance industry. Unfortunately, at a time when we are still fighting for basic behavioral health parity enforcement, the governor proposed slashing resources for this critical office, jeopardizing equitable access to behavioral health care. The proposal cuts the office's funding by more than 70%, eliminating 3 critical staff positions. This drastic reduction would severely limit the office's ability to function and squander its potential before it even has the chance to make an impact. The enabling statute explicitly requires experience advocating for the behavioral health parity as a qualification for the advocate role. It promised not just a qualified leader to champion behavioral health equity, but a dedicated team, including an attorney and a patient care navigator, to provide critical support. The governor's budget abandons that potential, leaving the advocate without the resources necessary to fulfill this vital mission. Patients across Connecticut continue to face denials of necessary behavioral health care, and insurers have not been held accountable for violations. A recent Office of Health Strategy report revealed 4 of 7 major insurers in Connecticut exhibit federal warning signs of parity noncompliance. At a time when widespread noncompliance with our parity laws is suspected, eliminating an office charged with facilitating accountability is deeply concerning. Behavioral health parity is a legal and moral imperative, and a fully funded Office of the Behavioral Health Advocate, wherever it is eventually housed, is critical for achieving that goal. We urge the committee to restore the Office of Behavioral Health Advocate's funding to the FY25 level to ensure it can effectively fulfill its mission and safeguard access to behavioral health parity. Thank you.
Thank you very much. Appreciate that. Up next is Kathy Flaherty.
Good evening, Senator Austin and members of the Appropriations Committee. My name is Kathy Flaherty. I'm the Executive Director of Connecticut Legal Rights Project, and we represent DMIS clients who are living with a severe mental health condition, but also a member of the Keep the Promise Coalition focused on mental health advocacy. I want to echo the thoughts of both Tom Burr and Christian Damiana with regard to the Office of the Behavioral Health Care Advocate. It's really distressing that when this legislature has proposed a law that the governor signed establishing a very important office that would help ensure equitable access to behavioral health care, that before that office is even filled, before the position is even stood up, that there's a proposal to reduce the funding for that office. And it would leave it with just one person and not the 4 that were contemplated by the original enabling statute. So I would encourage this committee to consider restoring the funding for the Office of the Behavioral Health Care Advocate.
Thank you. Appreciate that. Corliss Santana.
Good afternoon, Senator Austin, Representative Walker, ranking members, Marcel Nuccio, and distinguished members of the Appropriations Committee. My name is Coralie Santana. I am the Policy and Advocacy Strategist with the Connecticut Project Action Fund. We are before you today to respectfully urge this body to allocate the necessary funding to implement absentee voting for every voter in fiscal year 26 and sustain it beyond that. Additionally, we ask for increased funding to support and maintain early voting. Budgets reflect our priorities, and Governor Lamont's proposed budget, which lacks the adequate funding for these critical voting reforms, signals that voting is not a priority for his administration. Connecticut voters have spoken clearly in the 2 consecutive elections in favor of expanding the ballot box. This past November, they delivered a decisive mandate ensuring that any eligible voter can make their voice heard, even if they can't make it to their specific polling place during open hours. The referendum passed with 58% support, a margin even greater than the presidential choice of Connecticut, demonstrating that voters from every corner of the state want a robust and accessible voting system. While there is no law to define exactly how absentee voting will function, we expect legislation to make its way through the Government Administration and Elections Committee. And as we prepare for its implementation, we must assume that the system should be robust, accessible, and built to serve all eligible voters fairly. Adequate funding now ensures that we create a process that is efficient from the start, rather than scrambling to fix gaps later. Ensuring a safe and accessible election is not just an obligation, it's a commitment to the voters who put their trust in you. Cutting early voting funds, which were already insufficient, would be a mistake. It would make elections more difficult, not just for voters, but for the local officials who work tirelessly to administer them. And so we also recommend that that distribution of funds be equitable. Democracy requires proper investment, especially when we can't depend on the federal administration for investment. We need resources to pay election workers, educate voters, and ensure that every town can run elections smoothly. A voter's ability to participate in democracy should not depend on their town's budget. Connecticut must make the necessary investment to guarantee that every eligible voter has access to the ballot box. And for these reasons, I urge members of the Appropriations Committee to include additional funding for early voting and funding for the timely implementation of absentee voting for everyone. Thank you so much for your time and consideration.
Thank you. Up next is Wendy Tyson Wood. All right. Up next is Paul Mazzara.
Signed it.
Up next is Martin Harris.
Senator Austin, Chairs Anwar and Ryan, Ranking Members Summers and Ackert, and members of the committee, good evening. My name is Martin Harris, and I'm a policy associate at the NAACP Legal Defense and Education Fund, also known as LDF. I am here to testify in support of fully funding the Connecticut Voting Rights Act, along with early and absentee voting. LDF was founded in 1940 under the leadership of Thurgood Marshall, who would later become the United States Supreme Court's first Black justice. For 85 years, we have focused on protecting and expanding voting rights for Black Americans. In recent years, we have prioritized state voting rights acts as a key strategy to protect Black voters from increasing attacks on our freedom to vote. As part of that effort, LDF was heavily involved in the advocacy efforts that led to the successful passage of the Connecticut Voting Rights Act. The Secretary of the State's office has indicated that $1.4 million is needed in each fiscal year to implement the requirements of the Connecticut Voting Rights Act. This amount was previously covered by American Rescue Plan Act funding and now must be directly appropriated by the legislature. To remain among the nation's leaders in state voting rights acts, Connecticut must fully fund the Connecticut Voting Rights Act protections through this biannual budget. And we are asking for you to meet the Secretary of State's full budget request. The Connecticut Voting Rights Act is the nation's most comprehensive state-level voting rights act. The law's robust protections add new legal tools to fight against racially discriminatory voting rules. It provides expanded language access, the democracy canon, and protections against voter intimidation, deception, and obstruction. Connecticut leads the nation by establishing a historic pre-clearance program and an election data hub. Pre-clearance stops discrimination before it occurs in high-risk places, and the Connecticut Voting Rights Act establishes the strongest program in the nation. The election database supports the rest of the Connecticut Voting Rights Act and the state's other forward-looking voting laws by facilitating best practices and enforcement. Without adequately funding these programs, the Connecticut Voting Rights Act would be severely undercut, jeopardizing the law's efficacy in protecting Black voters and other voters of color. As this country experiences attacks, not progress on voting rights at the federal level, the nation needs Connecticut's example more than ever. Enacting the Connecticut Voting Rights Act was a commitment to the state's Black voters. Now is a critical time to double down on this commitment, not walk it back. I strongly urge this committee to fully fund the Connecticut Voting Rights Act, early voting, and no excuse absentee voting. Thank you for your time and consideration on this matter.
Thank you. Up next is Helen Fried. And not here in person either. James Jeter. James. Go ahead.
First of all, thank you, to Senator Austin and distinguished members of the Appropriations Committee for allowing me to submit testimony in support of fully funding the Connecticut Voting Rights Act, early voting, and no excuse absentee balloting, making sure that our communities have the most access to the ballot as possible. As a advocate for engagement who works primarily in our urban cities and amongst our most vulnerable populations, it is very hard to engage people as it is around the necessity of understanding and partaking in their own governance, to limit or to underfund the ability to have as much robust access as possible for people who are not being given the tools to understand governance right now. It hurts our communities even furthermore. The most equitable thing we could do is make sure that we have a robust system and that everybody have the access and ability to vote. So I'm submitting testimony for the full funding of these. These are tools that we need right now because our democracy is under attack. We have to shore up our state democracy. Like that. I don't think it gets any more serious than at a time right now. We haven't had this many times in our country. This isn't just an economic issue or a crisis of international politics. That we have a real issue where democracy is under attack, and if we don't, as a state, make sure that we're shoring it up here, we don't know what's going to happen down the line. So I urge you to make sure that there's enough money for this. Thank you.
Thank you. Have a nice night. Up next is Jess Zakino.
Hi, Senator Anwar, Representative Ryan, ranking members and members of the Appropriation General Government A Subcommittee, and Chairs Austin and Walker. My name is Jess Zaccanino, and I'm the Policy Counsel of the American Civil Liberties Union of Connecticut. I'm here to testify in support of full funding of the Connecticut Voting Rights Act, no excuse absentee voting, and early voting in the budget. Voting is a foundation of democracy, the right through which all our other rights are protected. The importance of this right to vote cannot be overstated. Despite Connecticut's progressive reputation, there are still discriminatory barriers to equal participation in our democracy for Black voters and voters of color, and people whose first language is not English. We're witnessing a widespread attack on voting rights at the federal level and in other states. While other states have restricted the right to vote, Connecticut has made real progress in the last 2 years. The Connecticut Voting Rights Act is the most progressive and comprehensive state voting rights act in the country and a model to other states. At the same time, Connecticut voters decided at the ballot box that the state should be able to permit early voting and no excuse absentee voting. The ACLU of Connecticut was dismayed to discover the inadequate funding proposition for the Voting Rights Act, early voting, and no excuse absentee voting in the governor's budget. This is not the time to play dice with democratic tentpoles and institutions, and voting is a cornerstone of our democracy. We need not be speaking in terms of restrictions and cutbacks and only providing voting access when it's convenient. The exhaustion of the American Rescue Plan Act funds is not an excuse to deprioritize healthy and accessible voting practices in this state. It is necessary for our budget to enact the will of the people, and not properly funding voting at every opportunity and in full force is tantamount to weakening the protections and voting access required to be a state that truly believes in a democracy and the will of the people. This means that our budget must include full funding for all facets of the CTVRA, full funding for early voting, and full funding to implement a no-excuse absentee voting system by the 2026 gubernatorial election, ensuring a secure and accessible rollout without cutting early voting days or funding for other voting methods. We deeply appreciate this committee's time and dedication to ensuring that Connecticut's voting system remains a model of accessibility, security, and efficiency. We're committed to providing any necessary support to ensure that voting remains feasible and manageable in all facets, including the CTVRA, early voting, and no excuse absentee voting. We urge the subcommittee to fully fund voting in this biennial budget. Thank you and happy Valentine's Day.
Thank you. Up next is Alex Knopp. And he's not here in person either. Up next is Nancy Walton. No, she's not online. I know that. Nancy Walton, no. Up next is Isabel Barber.
Good afternoon, Senator Anwar, Representative Ryan, Ranking Members Summers and Ackert, and members of the General Government, a subcommittee of the Appropriations Committee. My name is Isabel Barber, and I'm a resident of Old Lyme. You have my written testimony, and you've heard really robust testimony about the importance of fully funding the Connecticut Voting Rights Act. I want you to know that in the town that I live in, there were poll workers who were ill-informed about the polling regulations in Connecticut, who really wanted to have driver's license IDs and really needed some information about kind of the changes in Connecticut voting. So, just as a personal story of why we need to really invest in early voting, in the CTVRA, and in no excuse absentee voting. I really bring the perspective of somebody who has enjoyed these the incredible voting access. I came here from Oregon, where we have a lot of inclusive voting, and it's really made democracy so much more accessible in that state. I also want to add something that I haven't heard even in this robust testimony, which is that it's really important to understand that inclusive voting policies and higher civic participation, the people in those communities and states that have that inclusive voting and that civic participation have better health as well. And the reverse is also true. Folks who live in states and communities with, more restrictive voting have worse health outcomes. And there's really robust data on this connection. So, when you think about some of the spending and work in the budget to support early childhood, that's a really smart investment. And we'd want to leverage that investment, right, by making sure that we are increasing civic participation, increasing voting access, because that is what's going to help people in our state to be more healthy. This is a really strong connection, and it's even, the American Medical Association, America's health rankings. This is even in the Connecticut health assessment that voting is connected to this. So please understand that fully funding and increasing access to voting is important, not only because it's the right thing to do, not only because, be keeping a promise to Connecticut voters, but also because this has outcomes beyond just the voting itself. When we can fully participate in our communities, we are healthier. When we are healthier, we can fully participate in our communities. As a closing personal note, I just wanted to include that I have a family member who has a range of mental health needs, and it's been the nightmare of my life to struggle in Connecticut to find services. So the extent to which there can be funding for, the behavioral health advocate, I think that's really critical in Connecticut. And I'll end on that note. Thank you.
Thank you. Have a nice night. Up next is Walter Glom, who is not online and is not here in person. I am calling an end to, we have done due diligence. There's nobody outside waiting to come on. There's nobody online waiting to come on. We are adjourning the public hearing. I hope everybody has a nice night and enjoy the commercial holiday that we are experiencing.